Hi everyone, and welcome to Webinar Wednesday. I'm your host, Jessica King, and I just wanted to quickly thank you for joining us today. Menopause is a natural part of all women's lives. We all know it's going to happen, but is anyone ever really fully prepared for it? Today's speaker, OB/GYN physician Dr. Deepali Patni, is going to spread some light on the facts, what to expect, how to deal with the symptoms, and how to relieve those symptoms that come along with menopause. Here's a little more info on today's speaker. Dr. Patni is board certified by the American Board of Obstetrics and Gynecology. Her clinical interests include well woman care and gynecological surgery. She joined Kelsey-Seybold in July of 2009. Happy 6-year anniversary, by the way. She's bilingual. She speaks English as well as Spanish. And a little personal fun fact about Dr. Patni, when she's not caring for patients, she enjoys traveling, reading, and spending time with her family. Don't forget, we'll be taking any questions you have at the end of the webinar. If a question pops up, just type it into your question box and we'll try to address it at the end of Dr. Patni's presentation. And now I'll turn it over to you, Dr. Patni.
Menopause can bring quite a few different physical changes. You can have hot flashes, night sweats, other symptoms. But it's also, a lot of women also expect the change. They know it's a natural change, and not everyone has significant or severe symptoms associated with menopause. Also, when you are in menopause, that's a really good time to update your different health factors and make sure that you have decreased your risk for heart disease and osteoporosis. So what are the different causes of menopause? So menopause is natural. It can be caused by different entities, but really it's just as you age, most women go into menopause. The ovaries just stop functioning and they stop making estrogen, progesterone, which are the hormones that your body needs to continue to have cycles. It's the end of your childbearing years and your ovaries just slowly slow down. You can also go into menopause if your ovaries are removed for any reason. Before you hit menopause, if your ovaries are removed, you will go into menopause at that point. Sometimes certain medications, such as chemotherapy, can actually shut down your ovaries and will put you into menopause at that time. Pelvic radiation can also disrupt your ovarian function and will put you into menopause at that time. Now, you could have a hysterectomy and leave your ovaries in, and not go into menopause. So it's the actual removal of the ovaries that puts you into menopause. A hysterectomy will keep you from having menstrual cycles, but you are not actually in menopause if you still have your ovaries and they are still functioning. They will continue to function until when your natural menopause was supposed to occur, with or without the uterus being there. So when does it happen? There's not a specific time that it happens for everyone. It is average age is usually around 50 to 51 years of age. A lot of women will realize that other members in their family will go into menopause around the same time. If their mom went into menopause later, then they may go in later. If they went in earlier, they may expect to go into menopause a little bit earlier. We can't predict it. So I can't say why one person goes into it at 48 and another one has to have periods until they're 52 or 53. It is considered menopause when you've had no cycle for a full calendar year, so 12 straight months, no spotting, no bleeding, and no other causes of not having a menstrual cycle. Menopause can start earlier or later. Some women will start menopause in their 40s or even earlier than that, and there's some women that will actually continue having menstrual cycles till they're in their 60s. Now, if you have menopause occur before 40 or your early 40s, then your risk factors are going to be a little bit different than those women that go in their mid-50s or later 50s due to the fact that you're losing estrogen so early in your life, and that's definitely something you need to discuss with your OB/GYN. Women that smoke tend to go through menopause a few years earlier than non-smokers. So transitions. So like we said before, menopause is not, it's not a disease. It doesn't happen at one finite moment. It's usually a transition. Most women will notice that their cycles will change over a period of time, and within 4 to 6 years, they'll notice some irregularity of their cycles, some menopausal symptoms that start to occur. And at some point, they will stop having periods altogether. They may start having hot flashes occasionally, changes in mood, changes in sleep cycle. Patients will also notice that they might get those symptoms for a couple months, and then they go away. And then they'll get symptoms again as they get closer to actual menopause. Excuse me. Perimenopause. So perimenopause is the term that we use for the time before menopause. It's a transition. Most of the time, perimenopause can last 4 to 6 years of age. It does not necessarily have to last that long, and nor does everybody have to experience it. I have some patients that just, one day just never have a period again, and they have no irregularity or no symptoms that are associated with it. That's not the norm, though. Most women will have some indication that their body is starting to go into menopause. During perimenopause, you can still get pregnant. So you are not truly in menopause till you haven't had a period for a full year. When you're in perimenopause, you could still be ovulating irregularly. So you may not be having regular cycles, but you cannot predict that at no point will you be ovulating. So you still need to use some sort of contraception at that point if you are not desiring pregnancy. They may still periodically function and are they unpredictable. So how long does perimenopause last? As I was saying, it could last anywhere from 4 to 6 years. It is not forever. At some point, your menopause will kick in, and you will stop having menstrual cycles altogether. The problem is we cannot predict how long it will be for one patient versus another patient. So health risks. So what are the things that we need to be aware of when you hit menopause? So certain health risks do increase for women as they are in the ages of menopause. You do have an increased risk of heart disease, which is actually one of the #1 causes of death for U.S. women, and an increased risk of osteoporosis. So what osteoporosis is the thinning of bones in their body. Most women have heard of osteoporosis and may be aware of it, but if you have a family history of osteoporosis or have some of the risk factors that make you more prone to osteoporosis, that is something that you really need to talk to your primary care doctor or your OB-GYN about early screening for osteoporosis. The loss of estrogen also can cause a increased risk of heart disease. So estrogen is considered to be protective for heart disease for women until menopause. But replacing estrogen and adding estrogen has not shown to actually be cardioprotective. So that is something that patients need to be aware of and realize that they need to reduce the risk of heart disease or stroke by lifestyle changes, diet changes, exercise, and keeping their blood pressure under good control. So how do you minimize your health risks? So like we were talking about, you're at an increased risk of osteoporosis. You can do supplementation of vitamin D and calcium. Those are the supplements that can help decrease your risk of osteoporosis and help supplement your bones. Also, like we were talking about, physical exercise and dietary changes can help decrease your risk of osteoporosis and heart disease. One of the main symptoms that patients come to me about during the time of menopause that seems to disrupt their life and their lifestyle is hot flashes. So hot flashes are pretty common. About 70 to 80% of all women will have some symptoms of hot flashes. Everybody's different on the severity of hot flashes. Some patients will have them very mildly, will have them rarely or not enough to really disrupt their lifestyle. Other patients, they're almost debilitating, where their sleep, their work, their mood, everything is significantly disruptive. So what is a hot flash? A hot flash is a brief feeling of heat. Oftentimes patients will say that it starts in their chest or their face and their neck. And they may also get splotchy, red blotches that appear on their chest, back, and arms. Oftentimes profuse sweating, and then often chills afterwards can occur. It's a thermoregulation imbalance. They can vary in intensity, and they can last anywhere between 30 seconds and 10 minutes. So how do you relieve hot flash symptoms? Well, you can first try to do some just modifications of dressing in light layers, using a fan. Exercise has shown to decrease rates of hot flashes and decrease severity. Avoiding spicy foods and heat, managing stress can help you deal with hot flashes. A lot of patients will complain that the hot flashes do disrupt their sleep cycles, where they'll have a hot flash, they'll be hot, they wake up, and then there are chills, which can be very disrupting and really affect your mood also. Using a fan in your bedroom might help. Avoid heavy bedding, light clothes or sheer materials. You can keep a damp cloth near your bed to cool yourself quickly, and keeping pets in animals out of your bed can help decrease the amount of hot flashes just due to the extra heat that they can give off. So now if you have moderate to severe symptoms and none of the other techniques seem to be helping and you're still suffering from severe hot flashes or moderate hot flashes, we do have other treatments that are available to you. There are multiple different treatments, and oftentimes you need to discuss with your physician which ones suit you the best and which ones you are a candidate for. So I'm just going to briefly go over some of the ones that are available out there, and we'll just briefly touch on who may be a candidate, who may not be a candidate. So there are hormonal therapies that are available for hot flashes. The one that is used the most often is estrogen. So most patients that hit menopause have a drop in estrogen, and that is what's causing the hot flashes. Estrogen is known to be the most effective for decreasing hot flashes when they've done trials. There's many different types of estrogen formulations that are available. There's pills, sprays, gels, tablets, vaginal rings. So there's multiple different forms and schedules that patients can use to replace estrogen back in their bodies. We need to also be aware that patients that still have a uterus cannot take estrogen alone. They need to continue to take estrogen with progesterone. Progesterone is the other hormone that has been used to help hot flashes, but the progesterone provides a protective effect on your uterus. So if you have a uterus and have not had a hysterectomy and you're taking estrogen, you could be at increased risk of endometrial cancer unless you're also taking progesterone. Progesterone alone has been used to help hot flashes, and it is shown to have some efficacy, not as much as estrogen, but does seem to help those patients that have severe hot flashes and that cannot take estrogen. So certain patients may not be good candidates for estrogen and progesterone therapy. They may have heart disease, recent stroke, may have an increased risk of breast cancer. So definitely these need to be discussed with your provider and to see if you are a good candidate, if this is something that you're interested in. Testosterone has been used but has not found to be very effective in decreasing the amount of hot flashes. It has shown to be a little bit helpful in improving libido, but has not decreased hot flashes. There are also a significant amount associated with testosterone and is not necessarily used for hot flashes. Another thing a lot of patients have been aware of are hormone therapies that are called bioidenticals. So bioidenticals are estrogen or progesterone formulations that are compounded most of the time. The concern with bioidenticals is that they're not regulated, and you may not necessarily be getting the same amount of hormone in each compound that you do each time. Also, just a person that may have risks or may not be able to take estrogen, progesterone due to their health risk does not necessarily mean that bioidenticals will be safe for them also. So that's something that you really do need to discuss. SSRIs are a drug class that have been used to treat hot flashes. It is an anti-anxiety, antidepressant, shown to be quite effective in treating hot flashes, so about 62% efficacy. So for patients that cannot take any form of hormonal therapy or do not desire to take any hormonal medications but do suffer from moderate to severe symptoms, oftentimes I will start with an SSRI, and I have had very good experience with it. A lot of patients tolerate it quite well, where their hot flashes may not be completely gone, but decreased and controlled to the point where they're able to improve their lifestyle and their function. Clonidine is a blood pressure medication that has been used for hot flashes. It's not as effective as many of the other medications out there, and there's side effects of dry mouth, insomnia, and drowsiness. So honestly, I don't use it very often. Gabapentin has shown to have a 50% reduction in vasomotor symptoms, so hot flashes, but their side effects are dizziness, sleepiness, peripheral edema, so we don't actually use it very often. Another option would be doing something like an herbal medication or over-the-counter phytoestrogen, which is a soy-based, plant-based estrogen product. So there's no increased risk such as overstimulation of the endometrium, but there has been only a slight improvement in vasomotor symptoms or hot flashes when they compared using those medications with placebo. That being said, the placebo effect should not be discounted. A lot of patients will get a good amount of relief just from knowing that taking something that is not harmful and that may be helpful may help decrease their hot flashes. Some other herbal medications, some Chinese herbs and acupuncture are found to be often, when you use them together, have found to be effective as hormone replacement therapy. There's some data also out there on black cohosh. There's conflicting data, but some studies do show that there is some improvement. And there's a couple of other medications that really haven't shown to be much more useful than placebo. Vitamin E supplementation has shown some marginal reduction in hot flashes. Acupuncture on its own has not really shown to have a significant benefit. Well, some of the other things that you can try to do is to avoid caffeine and alcohol to try to see if you can decrease your symptoms of hot flashes. That's kind of the basic stuff I wanted to go over today. And do we have any questions?
So I actually have one to start us out with. Do genetics play a role in menopause? Like, do women usually follow in the footsteps of their mothers?
So a lot of women will go into menopause at the same time their mom did. They may or may not have the same symptoms that their mother did or their siblings did. But yes, it can definitely be coincide.
Okay. Here's one. Should you still take birth control during premenopause? You touched on that in the presentation, but what about during menopause or after menopause?
So you do not need to be on a contraception when you are in menopause, or once you've stopped having menstrual cycles for a full year, you are considered not to have reproductive ability, so you don't have to be on birth control then. You may have to be on birth control during the perimenopause time period because you can still potentially get pregnant.
Okay.
So before menopause, yes. After menopause, no.
Okay. What about vitamin supplements? Are there any good ones besides just vitamin D and calcium?
So definitely vitamin D and calcium, and that's to prevent osteoporosis. Vitamin E might help hot flashes. But other than that, other than doing a multivitamin and keeping a balanced diet, there's not anything specific that has shown to be really effective in menopause.
Okay. Whenever you go through menopause, do you get different body functions? Like I hear some women say that they randomly get facial hair because of menopause.
Sure. Well, with the drop of estrogen progesterone, there's not really an increase in testosterone, but maybe testosterone becomes more bioavailable. And so a lot of patients there's a lot of other symptoms other than hot flashes that happen with menopause. Skin changes is probably the one that we hear about the most often. Hair loss, dry skin, increased hair growth in a more of a male pattern, darker, coarser hair. Also weight will be put on weight gain, more put on like a man, like in their abdomen versus their hips and their legs. So patients will also notice a change in weight distribution.
Okay.
Vaginal dryness is probably the other really common symptom patients have with that lack of estrogen. Lots of times intercourse can be uncomfortable, or there can be a lot of vaginal dryness that can be irritating and more prone to vaginal infections.
Okay. Here's a question that just came in. Should I expect any effect on my mental facilities? I have a friend, faculty, sorry.
So, and the question is, she has a friend that she has trouble making decisions, but doesn't know if it's her menopause or other factors. So that's a good question. That's a pretty hard question to answer because there's not anything that says that menopause makes you lose your mental capabilities. But a lot of patients will have disturbances with their sleep and with their mood. So whenever that is occurring, you can definitely have difficulty with concentration, decision-making ability, because sleep deprivation can be pretty significant in some women. And that can really throw off a lot of your moods and your mental capabilities or faculties.
I think that's actually all of the time we have for questions. It's 12:30, so we're right on schedule. I want to quickly thank Dr. Patni for doing such a great job today, and thank you all for joining us.
So you just received a quick breakdown of the facts, symptoms, and how to address the symptoms. Whether you're going through menopause, think you're about to, or just wanted to better prepare yourself, you now have a better idea of what to expect. And be sure to check out our August presentation. Dr. Melanie Mazoon is doing it. It's called You Call the Shots, a close look at immunizations. You can go to kelsey-seybold.com/webinars to register. And also, don't forget to follow us on social media to join in on the conversations. Thanks again for tuning in, and we'll talk to you all next month.
Thank you.